Good afternoon, everyone, and thank you for joining us for this COVID-19 update and media briefing. I am Lisa Lord. We will be addressed this afternoon by the Minister of Health and Wellness, Lieutenant Colonel the Honourable Jeffrey Bostic, as well as the Minister of Home Affairs, Information and Public Affairs, the Honourable Wilfred Abrams. And we will begin with Minister Abrams.
Hi, good afternoon, Barbados. As has been our custom, when there's going to be a change in the directives or when the directives are going to expire, we try to give at least 48 hours notice of any changes. The current directive will expire on Monday, Monday 29th of June. Sorry, the current directive, which is directive number 10, is going to expire on this Monday. So the new directive that will come into effect from Tuesday, the 8th of June 2021, will expire on Monday, the 29th of June, 2021. There are very few changes to the directives. These changes are, I guess, in some measure expected, and they're as follows. Supermarkets, mini-marts, village shops are to reopen on Sundays. Automarts are to be allowed to do full service on Sundays as well. Spectatorless sports are to be fully allowed, subject, of course, to the COVID-19 protocols. Competitive sporting events, including horse racing, may only be held with the prior permission of the COVID monitoring unit. Those are the changes. With the exception of those changes, all of the directives or all of the provisions in the last directive, directive number 10, still remain in force. I will take you through those changes again. Supermarkets, mini-marts, village shops are to reopen on Sundays. Automarts are to be allowed full service on Sundays as well. Spectatorless sports are to be fully allowed, subject, of course, to the COVID-19 protocols. And competitive sporting events, which include horse racing, may only be held with the prior permission of the COVID monitoring unit. Thank you.
Mr. Abrams, we go now to Minister Bostic.
Good evening, Barbados. It has been a little while since I've been able to speak to you, at least for you to see me. I've done it on voice notes and on radio. But I'm happy to report this afternoon that the country continues to enjoy a relatively quiet period in terms of positive cases and the overall impact from a public health perspective caused by COVID. You would have recalled that we would have set ourselves some benchmarks early in the year where we were experiencing a surge. And one of those would have been the positivity rate, which we wanted to get down to 5%. And we had indicated then that below 5% really was what the threshold that we would have been aiming for. And this positivity rate went as high as about 12% in mid-February. And we were able to hit the threshold of 5% on the 6th of March. And since then, we have been trending downwards, and this is really a very, very good sign. I'm happy to report that the positivity rate reached its lowest level during the last week of May of about 0.5%, and that is the general range that we've been experiencing for the last several weeks. In terms of the cumulative incidence, we had set a target of 25 per 100,000 population. It peaked in February, where we were experiencing 583 cases per 100,000 population. But during the last 2 weeks of May, it reached our lowest levels of about 20 cases per 100,000 population. And I'm happy to report today that the cumulative incidence for the period 22nd of May to 4th of June stands at 15. The cumulative incidence for the period 22nd of May to the 4th of June stand at about 15. I'm also happy to give you the news that today we would have, the results for today are the stats. 557 tests were carried out by the Best dos Santos Public Health Laboratory, and we've had one positive case out of those 557 tests. The one positive is a non-Barbadian in-transit traveler, and so we've been having a pretty good day today, I would say. At the national level, things are going quite well, and I think that we are at this position, first of all, because generally speaking, Barbadians have been cooperating with the Ministry of Health and Wellness. Additionally, the hard work that is being done by public health officials, as well as all frontline workers from gas stations, supermarkets, you name it. So collectively, I think we have a lot to be happy about. We've been doing quite well. But there still remains some pockets of resistance as far as the virus is concerned. And those pockets of resistance have yielded some cases that you would have been seeing every day, thankfully, in the single digits. And on a couple occasions, we actually recorded 0 cases. And so it is the pocket of resistance that we are focusing on at this point in time. And our main area of concern today is the fact that we have another case in a secondary school. You would have heard over the last couple of weeks at least, that we would have been having some cases, single cases, mind you, in both primary and secondary schools, and also government schools as well as private schools. And so today, as a result of a developing family cluster of about 3 so far, 3 persons, we've had 1 positive student from the Lester Vaughan Secondary School. And because of the aggressive contact tracing that started yesterday, we've been able to make some determinations in terms of the primary contacts, and we have learned, for example, that there was some exposure at another government secondary school because of post-school interaction between the positive case and students of another secondary school. So we are on top of this situation. All persons are being tested today. That is, once they all turn up today. And this is because this is day 5 since this particular case would have been diagnosed from our perspective. And as a result of the testing today, we'll be in a very much better position by tomorrow to see exactly where this is leading to. It is not a big worry in relation to the school population, but obviously because of 1 or 2 peculiarities with this one as compared with others, we are really aggressively pursuing all leads. So that is the situation as it relates to schools. And on another program, I promised 1 or 2 callers that I would spend a couple minutes addressing specifically issues in relation to our schools, our school children. And I want to speak to school children just as much as I would wish to speak to the parents. Our children, and I really must compliment them so far, really, because it has not been easy for you school children or students, not easy at all. We've been asking you to do a lot of things that are not natural, things that are not really part of the way you develop, the way we have been able to develop as young persons back in our time. You're faced with a situation where social interactions have been restricted, especially at school. And that is something that is critical to your development. You're in a situation where you are not allowed to play the kind of sports that you would normally be able to play because of COVID. You've not been able to attend school in the same way that you normally would. And so you would have had your own challenges in relation to your school curriculum, and especially for those who are preparing to take examinations. And I'm satisfied that within the schools and during school time that things are quite good. In fact, in most cases, very good in relation to protocols. But I want to make a special appeal to you students and to the parents of the students, because you and all of us as parents, we do have a responsibility to make sure that our children get it in their heads to be able to deal with this situation. And so the challenge that we are having is that the post-school activities and interactions, that's where we are most vulnerable. And we continue to be most vulnerable. I myself have observed this on several occasions driving around, and especially outside of the school at the bus sheds or bus stops where you have 30, 40 students waiting for transportation. I have seen the vast majority of those students not wearing a mask. I've seen almost all of those students huddled together and not observing any sort of physical distancing or protocols. And this is why I really want to speak to you, because it is vitally important that you do this, especially when you're not being monitored at school. So in the preschool period and the post-school period, when you're taking public transportation, this is extremely important. And why am I saying this to you? I am doing so because we all know, and we experienced it back in late December, early January, where with our very best effort, sometimes a case gets away. And because of not following the protocols, you can really cause a spread that would make life difficult for us to be able to contain it. And so far, we've been doing well, even though we've been having the odd case at a secondary or primary school, and that is because the protocols within the schools are very, very good. But I am appealing to you in your communities, students, in the private transportation, at the bus stops, when you know that the teachers are not around or the school monitors, we are counting on you to do the right thing, and counting on parents to ensure that students, that their children, their charges, their wards do the right thing and continue to observe the protocols. And finally, I'm happy to report that we have over 81,000 persons who would have received their first vaccination, 81,000 plus, and I'm using plus because this is an ongoing process as we speak. And 61,000 plus persons, just over 61,000 persons have received the second dose. And this is important, very important indeed, because in some other countries, people do take the first dose and do not return for the second dose. We are seeing something completely different in Barbados, and we are very thankful for this. So that, as I said, 81,000 plus with first dose, 61,000 plus with the second dose. So congratulations. Thank you, Barbados. Thank you for coming forward to be vaccinated. And I say lastly, I will say this to everyone, those of you who have not yet done so, I can only encourage you to do so. And I tell you, don't hesitate, vaccinate. Thank you.
Thank you very much, Minister Bostic. And we're joined now by the Minister of Tourism and International Transport, Senator the Honourable Lisa Cummins.
Thank you very much, Lisa. Good afternoon, Barbados. It is a pleasure to be here with you this evening again to have an opportunity to share about another exciting announcement. We are preparing, as many of you may have heard already, to welcome back for the first time in over 15 months cruise ships to Barbados. We have the Celebrity Millennial that will be making a transit call on Barbados on Monday. She will arrive in Barbados at approximately 11 a.m. in the morning. Well, they will begin to disembark around 11 in the morning. And this has been a long process. We have not made the decision to receive cruise ships back to Barbados lightly. It has been over a year of discussions, negotiations, engagement at the level of the CDC, the EU Healthy Sail Guidelines, working through the America's Cruise Task Force, which I've spoken about before, which is, as you know, chaired by the President and CEO of Royal Caribbean, Mr. Michael Bailey, and Prime Minister of Barbados, Prime Minister Motley, and has representation from all of the cruise industry partners around the globe and all of the tourism ministry officials and the port officials in many instances as well from across the Caribbean. We're talking about English-speaking Caribbean, Spanish-speaking Caribbean, the French-speaking Caribbean. As far up as Puerto Rico, we have been having these year-long discussions. And what have we been looking at? We've been looking at what changes have been made to allow for sailing to take place on board the ship in the first instance. What is required before a person leaves their country of origin to embark on a ship. And then ultimately, what has been of primary concern to us, when all of those things have been completed, what happens when a passenger arrives in Barbados? And I want to spend a little bit of time just talking the country through what that has been so far and what we have been able to agree on. And so, like I said, these are drawn from the EU Healthy Sail Guidelines, the CDC sail orders, which have been now issued, and provisional arrangements made for what takes place on the cruise lines, and all of the work that went into the America's Cruise Task Force, as I have outlined. So, of course, the first and the basic parameter is, of course, the Barbados entry protocols. We already know people are required to come into the country with a valid negative PCR test prior to arrival, 3 days prior to arrival. For ships, it is going to be the same thing. There is testing that is going to be taking place on board the ships that will make sure that people are continually kept safe. But there are multiple different scenarios, and we want to spend some time just talking you through what that looks like. So everybody's comfortable that we have been robust and rigorous in the assessment of what the parameters need to be, what the risk is going to be, what risks are going to be posed, and what measures need to be put in place. And I want to pause for a moment to express my appreciation to the teams from the Ministry of Health, from the Barbados Tourism side, and from the Barbados Port team, who have worked extremely hard over the last few months, making sure that we have gotten to this point. Thank you all very much. So, what are we put in place? Now, there are at least 3 different types of parameters that we needed to consider for cruising. One, for home porting, for ships that are based here in Barbados. People are going to be flying in, so they're going to have to meet the requirements first for boarding an aircraft, which would be a negative PCR test before. Then they land in Barbados and they're taken by a sterile corridor directly to the port, where they then have to be subjected to further screening in order to embark on the ship, which is home ported here in Barbados. But what's most important is that so far, what we have begun has been vaccinated only cruises. So 100% of the persons on these ships will be vaccinated. They did not hesitate, they decided to vaccinate. And so that's what Minister of Health just said, and I think that's probably going to be one of the things that we will probably have to steal from him in time to come. But yes, so 100% of the crew and 100% of the passengers all vaccinated, all tested prior to departure from their country of origin. In this case, the Celebrity Millennium is home porting in St. Martin, and so they are going to be leaving from St. Martin, and the first port of call on Monday will be Barbados. They will arrive in Barbados having done their 3 days prior to arrival test, as is required for Barbados, and then they will be subjected to the screening on board the vessel, and then when they arrive here in Barbados. There will also be bubble tours. Now, what's a bubble tour, you ask? What that means is that we're restricting what types of activity can be undertaken at this stage. Because despite our best efforts and despite the level of rigor that we have put into developing these protocols, this is still the first ship. We need to take small, confident but careful steps. And so we're not opening the doors and the floodgates immediately. We're just doing this deliberately but slowly and gradually. By the time we have the first call on Monday, we're going to be in a position to review where we are. Are we going to be 100% satisfied? I'm hopeful that we're going to be pretty close. But what we're going to be doing is reviewing how this goes. So what this means now is that we're going to be looking at the various tours that they will be taking. We have been meeting with the taxi operators, with the various tour operators, making sure that everyone is aware of what the arrangements are and the protocols are being followed at every single step of the way. And I want to give Barbados the assurance that in collaboration with the Ministry of Health and with all of the partners involved in this process, every single protocol is going to be followed. But most importantly, you are dealing with 100% fully vaccinated cruise passengers, and I want to reiterate that. Now, the second issue that I want to spend a moment on is really the importance of getting the cruise industry and making those steady steps that I made reference to in the tourism industry, making them more deliberate as we go forward. There are many people who are looking forward to being able to earn again. There are many people who have not earned since March of over a year ago. And they're looking forward to being able, just like everyone else, to having their own access to cash and not having to depend on anyone else. They want to work. We need to be able to give them the space to breathe. We need to give them the opportunity to support their families and their children. And so it is that careful, very delicate balancing act that we're trying to strike between public health and people's lives and livelihoods and their ability to feed and support their families. So what are we also hoping to be able to do? And we're working on this now. We have, for the first time, created, and this was something that has been in the works for quite some time, I believe perhaps more than a year and a half. It has been in the process of being in development, and we're now preparing to launch it with the full support of the cruise partners. The Bridgetown Alive Tours, that is a package of tours that was developed in collaboration with the local attractions, the local taxi and the small tour operators, and the cruise industries. And they are going to be developing dedicated tours for small operators that allow people to get a piece of the action. We have historically seen over many years that we have seen mainly large entities benefiting from the cruise industry based on the structure of the cruise industry. And what we have sought to do, certainly for over a year and a half now, in the Ministry of Tourism and in collaboration with the Barbados Port and with all of the partners, is to develop opportunities for small business people to also have a part of the pie, a piece of the pie. And so, in summary, we have the Celebrity Millennial on Monday. We have the cruise execs who will be sailing, building confidence. They too will be on the ship for the inaugural sailing. We also will have a number of traveling journalists who will be featuring Barbados. They will be on the ship, but it will be a small scale down protocol style reception for the ship, not anywhere similar to what we would have done before under normal circumstances, but this is a COVID style reception with minimal activity in the port, but a Barbados style welcome. And we're looking forward to all Barbados, all Barbadians joining us in welcoming the first cruise ship back to Barbados in full observance of the cruise protocols. So I'm going to pause there and I'll come back a little later. Thank you very much.
Thank you as well, Minister Cummins. We now go to members of the media, and joining us are Akil Lovell, Starcom Network, Trevor Thorpe, CBC, Marsha Gittins, the Barbados Advocate, and Colville Mounsey, Nation News. Your questions?
Good afternoon, everyone. Just one question quickly for Minister of Health. Based on the definition of community spread, that's basically not being able to trace your cases. Do we still have community spread? Because you're just mentioning sporadic cases, and you have linked all to clusters. Do we still have community spread at this point?
The answer is yes, we do. And they say yes, we do because there have been one or two cases, not many, for which we have not been able to find the link. But coming from where we were several months ago, we had widespread community spread. Then what I'm saying is that at this point in time, the cases that we've had over the last several weeks have not been across the country. In fact, they've been in certain areas of the country. And so I can tell you we do not have a widespread community spread, but community spread existed when we reported. It was widespread. We've been able to contain the situation to the extent now that we are not seeing cases popping up in too many parts of the country.
And Mr. Minister Abrams, good afternoon to everyone. Horse racing, I find it a little difficult to understand the thinking behind the competitive sport and horse racing, simply because of how horse racing is run.
Further clarify that, so I'm in a position to actually answer you.
You've allowed the other sports are getting the opening, but not horse racing. Horse and jockey, the public is in the grandstand and things like that.
Spectatorless sports are fully allowed to go on subject to COVID protocols. So these are sports, if persons are playing football in a village, you can practice, you can train, you can fully go back into your sports once you obey and observe the protocols. Horse racing, as you indicated, did give us some pause because of the nature of horse racing and because of our perception of what happens at the Garrison. Anytime we think of horse racing, we think of a ton of people on the infield, people in the grandstand, persons running, leading in the horses, and it's a whole picnic and festive atmosphere. That's what horse racing is associated with in Barbados. The horse racing fraternity in this instance was exceedingly proactive. We, as a COVID committee, we had looked at what protocols we would require to accommodate the different sports. The protocols would not be the same, or the requirements for each sport would not be the same, but it's based on the nature of the sport and the perception of the sport and the things that are inherent in the sport itself. The horse racing fraternity actually came with protocols that were over and above what it was. Their proposal was over and above what it was that we were even thinking of or contemplating. And they had it well thought out. They explained that on a normal day with horse racing, you may have 300, 400 persons who are involved, sorry, not horse racing, in a normal day at the Garrison, so not including horse racing. On an average day, you get about 300 or 400 persons there, including grooms, jockeys, people tending to the track, people doing maintenance, people cutting the grass. And the protocols or the requirements when we have the horse racing there without spectators, they anticipate no more than 400 or 500 persons at the maximum. And quite frankly, if we don't have the spectators there, then the police that are normally deployed to deal with the spectators can be deployed to deal with the traffic management to ensure that persons don't come. But all the other things associated with horse racing can continue. The gaming, the placing of bets, whatnot, and they have put provisions in place for these to be done online. I mean, the horse racing fraternity came full out with a very, very comprehensive proposal that we thought made sense, and we prepared to give it a try. They estimate that the persons who, so for example, if given permission, only persons connected with the horses racing on that day will be allowed to attend. So although you might be a horse owner, if your horse is not racing on a particular day, then you will not be in attendance at the Garrison. So based on the proposals that they put, based on the numbers that were estimated, and it was easy to actually do a check of this because we know the persons who are involved in it, we know who owns the horses, we know how many people are associated with the stable, we have some idea of how many persons come in relation to a particular horse on a particular day. So we are comfortable that the proposals by the horse racing fraternity are no less strict than what obtains right now in a non-racing day. So we're comfortable with that. That is why horse racing has been included. So you will not be expecting to see a whole ton of people at the Garrison because horse racing, for now, will be spectatorless.
What about crop over, Mr. Minister?
That's a ways from here, and that depends on a number of things. We evaluate this every single week, multiple times a week. We look at the pros and the cons. We look at particular requests that persons may make because special interest groups will come and ask us things, so please consider this. Crop over right now, I can't say too much on that. What I can tell you is that we're closely monitoring what is happening in the country, and the Minister of Health and the Prime Minister have made it exceedingly clear that where we go from here depends on the amount of persons we're vaccinated, that are vaccinated in the country, and when we actually achieve herd immunity. So a lot is riding on the vaccinations. In the grand scheme of things, for us to return to some level of normalcy in Barbados where people are comfortable moving around and we can sort of get back to some degree of normal social interaction, it will depend largely on when we hit that target set by the Ministry of Health to achieve herd immunity. And that is not just Barbados, that's across the board. As Minister Bostic just said, don't hesitate, vaccinate. I think Minister Bostic is actually going to weigh in on this as well.
Well, actually, I wanted to weigh in on the sports for absolute clarity so that no one leaves here without fully understanding what is being said. And in relation to the sports that Minister Abrams would have spoken to, it is real. When he says spectator sport, we are looking at competitive sports that obviously would attract spectators. And we are not saying for one moment that this cannot take place. But we have not opened it up in a general sense because we believe that the sporting associations and organizations need to meet with us so that they can explain exactly how they plan to proceed with restarting their domestic competitions, and we would be able to give them guidance and advice, and also to be able to inspect facilities and so on, so that we are all on the same sheet of music. But it is our intent to return to as normal a state as possible for sports in this country, and that is the guidance that the Ministry of Health and Wellness has provided for the National Sporting Associations as well as the COVID subcommittee. In relation to Propover, that's another matter that we cannot answer at this point in time because that involves another ministry with responsibility for culture, but in due course, those matters will be made public in one way or another.
Akil Level Starcom Network. My question is directed to Senator Lisa Cummins. Two questions. There has been a recent upsurge of gunplay across the country. How do you see this affecting the country's progress in trying to rebound the tourism sector? And secondly, how many tourists are expected to arrive in Barbados for the summer period, and mainly from which countries?
Let me start from the beginning. Thanks for the question, Akil. I think it's a fair question to ask about the connection between violence of any kind and the tourism product. But I think first and foremost, one of the things that we're very clear on is that Barbados has to be safe for Barbadians and Barbados first. And then everyone else, including our visitors who come here, will be safe. And so we have to focus not necessarily on the connection between visitors and gun violence and visitors and crime, but it has to absolutely be Barbados being safe for Barbadians. Everyone else will come thereafter. The second question is about persons who are arriving on island. So I don't remember if I said it earlier, but on the particular vessel arriving on Monday, there will be 630 persons on board that vessel. Typically, when we have cruise visitors, we're used to hearing much higher numbers. So we would normally have a vessel that comes in with 1,500, 3,000, sometimes up to 6,000, 5,000 passengers could be on a single ship. But much like we are seeing here in Barbados, and it's important for us to understand that if there is a notion of what is globalized, COVID is that which is globalized, including COVID protocols. So ships are sailing at 50% of capacity. So they're not sailing with all their cabins filled as they would have done before. 50% of capacity, and so they are now at 630 persons on this particular ship, but we could go as high a little later on as 1,500 persons because the ship has the capacity to accommodate 3,000, but we are going to be remaining at 1,500. Now, for the summer, I think I've shared a little bit about this before in terms of our projections. What we have heard from all of our markets is that in the last quarter of the year, quarter 4, and then into the quarter 3, we have extremely strong progress projections. Quarter 4, extremely strong. Quarter 3, very strong. The summer months are softer, largely because we still do not have significant travel coming out of the UK. As you know, the UK has a traffic light system, and so there's a disincentive for persons to travel, and there's actually a travel advisory asking persons not to travel for the most part. Europe, in some instances, is going through its third wave of the COVID pandemic, and so travel has been dampened there. So we're not seeing for the summer months a lot of traffic coming out of Europe, and most certainly even less coming out of the UK. Canada, thankfully, we are very pleased to announce that Canada has resumed travel to sun destinations in the Caribbean beginning this month, and we will begin to see very shortly the resumption of flights on the Canadian carrier, particularly Air Canada. We will see WestJet returning a little later on in the year, so the Canadian market will begin to reopen over the course of this month, and we will be watching to see what the load factors and the projections are for later on in the year. But the demand in the Canadian market is quite high, and what is it's important for us, in particular in the Canadian market, as countries continue to roll out their own domestic vaccination programs, as they continue to ensure they get their own COVID rates under control and their infection rates under control and variants under control, then it makes easier travel for persons coming out of those different jurisdictions. And then out of the US market, the demand has been extremely strong. I know that many people can tell you that if they were trying to get a seat on most of the US carriers originating out of Miami, New York, or Charlotte, any of those gateways, it is difficult, especially on the Miami and the New York leg, to get a seat. Earlier in the year, we were probably sometimes seeing flights coming into Barbados with 6 people, 10 people. Sometimes you would have a flight heading back out with 36 people on board. Now the flights are full because the US market has achieved, one, a high level of herd immunity. They're widely vaccinated. The majority of US visitors that we're seeing coming into Barbados are vaccinated, and they are anxious to travel. So what I would say to you then in summary is that the US market is looking as though it is likely to be our strongest market for the summer, and we will see how the Canadian market shapes up, certainly between July and August. I hope that answers your question. Akil?
Two questions for you, Minister Cummins. Firstly, the bubble tours. Could you tell us what that means for the average taxi operator? Would they be getting some spill off of that as well? And secondly, given what would have taken place in the Seychelles, another tourist dependent destination with a very high level of vaccinations,